Welcome back. It's 3 minutes gone past the 5 o'clock hour. Welcoming you to Hard Fact. It's the nation's #1 talk news and sports radio station, 99.3 Nigeria Info. We're broadcasting live from our audiovisual studios right here in Itimi and Crescent, Victoria Island, Lagos. This is the Big Hard Fact. I am Maryann Okon, and I did promise that we're going to be talking about health today. Yesterday, I did, hint that we will be having an important guest with us in the studio because we want to talk about the brain drain in the health sector. Sometimes we just gloss over these things when they make headlines, but then we fail to stay on the matter, especially with the intricacies, or for want of a better way to describe it, the what's at the core of the brain drain in the medical and the health sector. And today my guest gracefully joined us via Zoom, taking out time from her very busy schedule. I think that I have the magic, so I got her to say yes. And she's joining us to talk to us about the brain drain in the medical sector. Before I introduce her, she's looking really gorgeous today. Recently, we realized that about 58,000 out of 130,000 doctors have renewed their practicing license since 2023. In other words, instead of it going up, it's dwindling. And every time we just talk about these things as stories, and then we just maybe, jojo about it, and then we move on. We never really hold the people who supposedly are responsible for making things better in that area to account. But my guest, I guess, is going to be doing justice to this topic. Let me give you some background to who my guest is. She is a medical expert. She is a health economist, a public health practitioner with 37 years post-qualification experience. She's held roles in private and public sector of health systems in Lagos. She's also a former member of the governing body of the Lagos State Primary Health Care Board, and she is currently the second vice chairman of the Association of Public Health Physicians of Nigeria, Lagos State chapter. I might add that she's a super sports enthusiast and she's an avid supporter of the best team in the whole world, Arsenal FC. If you don't like it, I don't know what you want to do. My guest is Dr. Bolaji Obadeyi. It's so good to have you join us in the studio, Doctor. And I'm so excited because we support the same team. Thank you for joining us on the show.
Indeed. Good afternoon, Anne. Good afternoon, everyone listening to us across Nigeria. It's a pleasure to be here.
Great. You look absolutely gorgeous.
Oh, thank you.
Yeah. Let's start by, when I started my intro, I did talk about the fact that we gloss over these issues. We talk about them when they pop up, and then, after a while, we sweep it under the carpet. But for someone who's been in the sector for 37 years, you've obviously understood the rot in the system and how bad it has become. What gives you that staying power? What makes you continue to do what you do, even in the face of all of the things that you have to deal with in that sector?
Well, thank you, Anne. I think we must look at it from a historical perspective and ask ourselves, why are you in the healthcare profession? What's your motivation for training? The training isn't easy. There's commitment that goes into that. What's your primary motivation for being in the healthcare sector? I think that motivation, that passion for helping people, that ability to be present when somebody is ill and watch the transition as they get better and they get well, and know the part of that miracle, that allele is what brings us into the profession, and that's what's keeping us in the profession. One of my lecturers always says there are easier ways to make money than being a doctor. So if you're there
for the money, then
you're
the wrong job.
So it's about the passion and the fact that we're contributing to a greater cause, something bigger than ourselves. And within Lagos State, to know that you're part of decision making for producing healthcare for 25 million people, that's a unique lifetime opportunity that you can't get anywhere else. Lagos is about the size of Ghana. Ghana is 28 million. We're 22, 25 million. That's huge in the scope of what you're contributing to. So those are the factors that keep us grounded here, knowing that we're making impact and we're possibly living a legacy.
Let's talk about the rot, and we'll come back to Lagos, but let's talk about the country in general. Yes, Lagos might be a microcosm of, the larger country. Like I asked earlier on, why have we continuously had this persistent rot. I use the word loosely, or maybe I can just throw it out there, in the healthcare system, because I always say this to every health professional. When I was a little girl, for every few kilometers around your community, you'd find a primary healthcare post. But all those things have disappeared. And there's too many reasons. I'm sure you'd tell us what the reasons are. Many people will say, oh, there's no manpower. These buildings have been abandoned. Government has not given them what they need to work with. So again, what do you think is at the core of this rot?
Well, I think that rot, Anne, has crept up on us, like the proverbial story of the toad that you put in a pot of warm water and then you heat it up and you just don't know that things are decaying slowly around you. We get acclimatized and we continue to adjust and make room for the inefficiencies in our health sector. We start with little things. Like you say, when you were young, the PHCs were all there. When I can talk about when I was young, the PHCs were great. They were beautiful places. We look forward to going to have our child welfare clinics. At the end of the clinic, you get a little pack of milk. That was in this same country, Nigeria, or you get a small box of Smarties. If people ever remember what Smarties is these days, they give us that in the clinics just for checking your weight, your height, and all those simple things, and making sure you are vaccinated. That was Nigeria, and we had enough human resource for that. But over the years, I think the lack of consistent investment in the health sector, it happens year after year after year that we're underfunding the health sector, is what has led us to where we are today. The funds that the health sector receives is about in the region of 3 to 4%. We've done some very lucky years, but those are far and in between. We get about 3 to 4% of the national budget for health. The recommendation, if we're going to provide quality health care, is to dedicate at least 15% of our budget to health. So the fact that we're not investing in health, and it's not just the one odd year that we do it and we think we're getting away with it year after year, how we find ourselves in the situation that we're in. So what we have now is barely enough to pay salaries. There's been little or no investment in a capital investment in health for a very long time. The funds are just not there. That's on one side of the problem. The other side of the problem is that the healthcare sector is very much import dependent. Everything that we use, starting from gloves to syringes, apart from the fluids that we're beginning to produce here, the drugs that we use, the equipment, everything comes from other countries around us. So we must have foreign exchange, which we know hasn't been available for quite a while. And the interest, the gradient in the interest rate exchange is not favoring the health sector at all. So it's an accumulation of factors. It's also because
Doctor, are you there? We lost connection with you. Are you still there? Oh dear. Dr. Obadeyi, are you still there? Oh goodness gracious! I think that her connection has gone off. I'm guessing someone's calling her or something. But we'll try to get Dr. Obadeyi back on the line. Well, in case you're just joining us, the program is Hard Facts. And on the big Hard Facts today, we're talking about the brain drain in the medical and the health sector. And, of course, the fact that we're having less and less people in the medical and health sector. Dr. Obadeyi, we lost you for a few minutes. But, yes, you're back. Thank you.
I was saying is a consistent lack of investment that has taken its toll on the health sector, and the fact that the allure of the professions are gone. You know that nurses were beautiful people in the days past.
Yes.
There were people who dressed in lovely white uniforms. I'm beginning to see nurses who wear T-shirts on jeans and they're on duty. And I don't recognize that at all in our medical profession. So things have really, kind of slowly gone downhill. That's what we're having to deal with.
Let me take you to the education aspect of it. Many would say that, the brain drain is not just about, the people who want to go into the sector or the people who have left the country. It's also about the education that these people get. The fact that
Yeah.
education in itself is also not being prioritized, even with the SDG goals in mind. It's not prioritized, and so if more and more people are not even interested in that sector, to be doctors, to be nurses, because of course I'm thinking to myself, if I see how policemen are treated, I see how soldiers are treated in this country, how doctors and nurses are treated, I'd probably never want to go into that profession, because I don't want to suffer the same things that they're suffering. So what do we do in terms of saving the health, or the education part of this sector, because it starts from there. And I remember in my state there was a beautiful place for housemanship. I didn't even know what housemanship was at the time. I'll just be saying, what's housemanship? Do they house men?
Yes.
But it was one of the beautiful places. Calabar was one of those beautiful places to go for housemanship.
Yes.
But
Indeed.
I'm also hearing that all of those things have been, the places, all the infrastructure has been so degraded that even, so how do we even start rescuing that part before we bring out the people that were saying these are the doctors that we need in the sector? Let's start from there.
I think that's an excellent question, and I love the way you framed it, that we need to look, that will be upstream at the production process for producing healthcare workers, whether you are doctors or pharmacists or nurses or lab scientists. Let's look upstream at how we produce these people. We must be fair to ourselves. The requirement for getting into any of the medical cadres from the very beginning of your education is a very high one. When you can escape in primary school and with low grades, but when you get into secondary school, first of all, you have to choose the science option, which everyone knows is the more difficult option. And you must finish with very high grades. You're not the one to squeeze through with C's and D's. You must have high grades in about 5 or 6 different subjects. When you're done with that, you write the JAM exam. The requirement, the cutoff point in the JAM exam is highest for medicine, possibly followed by pharmacy, and then the other cadres. So at every level of the educational system, we're looking for the best of the best to go into our medical schools to study medicine and all the other, and pharmacy and all the other courses. So we're requiring that from our children, that they must be the best of the best. I think it's only fair that we also give them the best of the best opportunities when they come into the job field. But we're not doing that. It takes about 7 years, 6 to 7 years to finish your medical training. And then you realize that you're not even done. There's still what you call housemanship, which is like an apprenticeship or an internship, where you shadow a more experienced senior colleague through about 4 different postings. You finish with that. You go and do the NYSC, which is a requirement in our country, making it about 9 years altogether. For those who finish in the regulation time, if you go to a university where there are closures, you might be counting 11, 12, 13 years in which you
tell me about
training.
it.
If you look at that, Anne, in that same space of 13 years, some other young person has done a 4-year course and done that 3 times over. You are still in this medical thing, just chugging from one year to another. So I think it's only fair that when our doctors and pharmacists, when they come out of this rigorous and long training, that we recognize the investment that they've made in themselves, that their parents have made in them, and they've made in themselves, and that the remuneration, the conditions of service should be matching all that effort that they put into their training. But as you know, that's not what we're finding. So that's discouraging for parents who now are looking for short 4-year courses, computer science, economics, things that you finish and you can quickly go and start a career, rather than medicine where you're done and you can't even find a position for housemanship. Part of the problem with that is that the numbers that we're training now is a lot higher than the places we have for housemanship. When I finished my housemanship 37 odd years ago, it wasn't that difficult. I had 2 offers for a house job because we didn't have many people finishing from that many number of universities as we do have. So I don't think we're planning, we're not using data for decision making. We have those internship places, but we're not asking ourselves, how many doctors did we train last year? How many of them are not able to get a place? 2 years after qualification, they're still going around asking one uncle or auntie to help them get an internship place. If that's the case, how many doctors should we be training to match those internship places? So there's a lot of data that we're not yet gathering, that we're not yet making ourselves familiar with, and we're not planning with. I think that's one of the early discouraging things you find as a healthcare worker, that all that prestige they talk about in the training, in the medical school, it's not that much out there. Even accommodation that, as you say, when I finished school, and your houseman, you get a flat that has 2 rooms. You have a room, you can have somebody staying in the other room. I don't think those luxuries exist anymore. And they're not really luxuries. Those are basic things that you should give to somebody who has done a double degree. We get a master's degree when we finish, but it's more than that. I think you do your studying in double the time it takes for somebody who is doing a 3-year course or a 4-year course. So there's something that is inequitable about the remuneration you come out into as a medical doctor. Again, when we finished, you could get a job that would ask you, what color of car would you like, doctor? Would you like a red car, a black car? You want a white car, as it was in those days? Those things came with the job. Now, it really makes me sad to see what our young colleagues are having to, what they drive, those who drive anything at all. To find doctors at the bus stop struggling to get a car, to get a bus, it's just not how we should be. After 11 years of progressively intensive and complicated training, I think we come out to something that rewards that consistency.
I want to ask this very sensitive question that's probably going to put you in a precarious situation, or maybe put you in a corner. There are those who have said that in the history of this country, the only time someone has been in leadership and used a medical center in this country is the past former vice president who was taken care of here in the country. And I'm thinking that maybe it was just, permit me to say, slightly political, so that they say, somebody did it. But then, could it also be deliberate that the medical sector has been left in such a wonky state because these people don't necessarily use these facilities, and so they don't even appreciate what you're experiencing and what you have to deal with? Could it also be that it pays them for these places to be that way, so that every time they feel like, they'll just say, I built a world-class medical facility, and take the shine off you to a private medical center?
Yes.
And my last question, I know you can't answer everything at once. What are you doing as medical experts to continuously push for the priority of a public medical center as opposed to private?
Yes, I think your last question answers the previous 2 questions. If a question can answer a question, that's what you've just done, Anne. That as medical professionals, we somehow marginalize ourselves. We have not quite understood the link between politics and financing. That if you don't speak up for yourself in a particular space, then you don't get the allocation that matches what you need for what you need to do. We have not yet understood the economics of scarce resources, that when there are scarce resources, there's an opportunity cost for every decision that you make. And you really need to state your case. You need to have an argument. You need to deliver that argument to policymakers in a way that is clear and understandable to them. If you're asking them to double the budget, for example, from 3.4% to say 6.8% of the national budget to health, that doesn't happen automatically by itself. So I think as a set of professionals, we need to develop more advocacy skills. We need to have more of our members of our fraternity who are in leadership positions speaking up for the health sector and justifying it with data. I think data is an extremely powerful tool. Data is currency. If you want to make an argument, it should not be based on sentiment. It should not be based on what's going on. Okay, well, in Rwanda they spend this, in Botswana they spend this. Well, that's okay. But what's the data supporting that shift in policy in Nigeria? So I think we need to learn advocacy because where there's political will, as you see in other Rwanda, and it's happening in Lagos State, because Lagos State is turning things around. They are investing quite a lot in their own sector. I'm seeing it. If you go to the facilities, you see that there's improvement, but it's not yet across the whole state. I think that's happening is because the political will to move SPCs around to spend more here and take it away. Because when you spend more, they're taking it away from here. So that's something we need to fight for. Well,
Bolaji Obadeyi is here with me in the studio. She's a health economist. She's a lot to talk about. I want to talk to you. So we'll take a quick break. When we come back, the phone lines will be open, but then we'll touch on some other issues after the break. Stay with us. It's still Hard Facts, 99.3 Nigeria Info.
Who says you can't have it all with one play?
I got that defined boy. You have just won yourself
20,000! Congratulations!
Hello, good morning.
Yes, Melitus. One play, don't talk to two players because you won 20K.
So now you won yourself 20,000 naira. My name is Well Done. Okay, well done. You want to tell you well done? You won yourself 20,000 naira.
With 500 naira, you can play to win big from 120,000 naira to 190,000 on Nigeria Info. Go to one play and play with 500 nephews or dial *347*8803#. Win daily on Nigeria Info. 50,000 naira on Morning Crossfire. 60,000 naira on WhatsApp Lagos. 20,000 naira on Sunnyside and 60,000 naira on Game On. So Lagos, what are you waiting for? The more you play, the better your chances of winning. Remember to dial *47*880*3#. Play responsibly. Not suitable for persons 18.
Health, they say, is wealth. Securing good health and a hospital, and they insist on a healthy deposit.
But when Avon has your back, you won't have to scream because in the end, we all know. Visit Avon Healthcare Connect. Avon Health Plan for you and your people.
Empowering to live a healthier life.
Enjoy the delicious creamy goodness of Cowbell. Cowbell contains Vitarich and vitamin B9, which supports brain development. Use Cowbell in your tea, cereal, pap, and other meals of choice. Cowbell, so creamy, so good.
You define better odd. I be you one play cause over 1.5. I be you one bet. Say both seem no go score at all. Oh yeah, we get better payout. No worry, we there for you. Our odd chabra out. In all the feeling show. Oh lo lo, we there for you. Oh, we there for you. You see for bet baba, you feel we money. Bet baba, cash out today easy. Or bet baba, we get online games for you. To play all God all I want. Yeah, we get better bonus. Money me no dollar. Yeah, now bet baba day so. Cash out no sharp. Welcome to Bet Baba.
Register now on betbaba.ng. Not for people under 18.
New Lafarge water shield cement now confirm. Number one waterproof cement for Nigeria. Yeah. Ogbonge cement for waterlogged areas. Number one waterproof cement for Nigeria. Yeah. New Lafarge water shield cement number one. New Lafarge waterproof cement now confirm. One time. Put full stop for water wahala. With Lafarge water shield cement, water go collect. If water jam house, foundation and basement to call. No shaking. Ogbonge cement for waterlogged areas. Number one waterproof cement for Nigeria. Lafarge, not confirm. Cement, new Lafarge water shield cement not confirm.
Put full stop for water wahala.
Nah, dollar no go shame us.
Ìwọ Ọlọ́run, dollar no go shame us.
Kai wallahi. This dollar for no go shame us.
Dollar, shame me, ke. It don't fit. As a business owner where I be, prices of goods increase every minute, and it don't even get funny. Before I buy a market for my shop, they go say it don't increase.
Hello, madam, why don't increase?
Share you see what they talk. Not until Clan Africa begins supply my market. This one no be low, no. Then go supply my market or pay my supplier sharp before price go up. I go begin sell. They pay small. Now you see why dollar no fee shame me.
If you no one make you the worry say price go increase before you go buy your market, time don't reach. Make Clan Africa begin supply your market or pay your supplier. Or message us for WhatsApp 090-5333-3333 or visit our website at www.clan.africa. With Clan Africa, you fit get your market today. Make dollar not go shame you.
New Lafarge water shield cement now confirm. Number one waterproof cement for Naija. Yeah. Ogbonge cement for waterlogged areas. Number one waterproof cement for Naija. Yeah. New Lafarge water shield cement number one. New Lafarge waterproof cement now confirm. One time. Good full stop for water wahala. With Lafarge water shield cement, water go collect. If water jam house, foundation and basement to call, no shaking. Ogbonge cement for waterlogged areas. Number one waterproof cement for Naija. Lafarge, not confirm. Cement, new Lafarge water shield cement, not confirm.
Put full stop for water wahala.
Get in on the action with Betano, your exciting destination for sports betting. Enjoy an award-winning experience with amazing betting options, cash outs and missions, as well as other features. Join now and get a welcome bonus of up to 200,000 naira. Betano.ng, the game starts now.
Madam, you don't try this new Lush Hair 4-in-1 no-lie relaxer kit. We get free neutralizing shampoo and conditioner join.
What? Me, I know deal.
You're not even sabi waiting the apple for town. You see this Lush Hair relaxer so?
You know they pepper, you know they burn. It will even make your hair shine like oil.
Na so, Lush Hair relaxer kit na correct. We no go make your hair cut. We no go make your hair dry. You know they pepper and they relax hair well.
Go buy your own. Lush Hair. Be beautiful.
Health, they say, is wealth. But when securing good health costs you an arm and a leg, or when you are at the hospital and they insist on a hefty deposit before treatment,
But when Avon HMO has your back, you won't have to scream, Yekba, because in the end, we all need people. Visit avonhealthcare.com now to get an Avon health plan for you and your people.
Avon HMO, empowering you to live a healthier, fuller life.
It's the 10th edition of the AMVCA, and Super Commando is giving you the energy to fire on. Are you ready to show up and show out? So, whether you're nominated, performing, or just enjoying the action, fire on with your Super Commando energy drink. Fire on at the 10th edition of the African Magic Viewers' Choice Awards on the 11th of May 2024 at Eco Hotel, Victoria Island, Lagos. Super Commando energy drink. Fire on.
Enjoy the delicious creamy goodness of cowbell. Cowbell contains Vitarich and vitamin B9, which supports brain development. Use cowbell in your tea, cereal, pap, and other meals of choice. Cowbell, so creamy, so good.
meals have a way of taking us on a journey. And when you add plenty of vegetables like efo, ugu, and season with the rich taste of North seasoning cubes, even better.
So, go ahead and elevate your meals with more vegetables and the rich taste of Knorr cubes. Today, eat for good.
Every parent wants to see their child growing up happy and healthy.
Introducing Renzo Vitamins for Kids, a secret to your child's daily nutrition and boundless joy. With Renzo Vitamins, your child will have the energy to embrace every moment and unlock their full potential. Give your child a head start in life with Renzo Vitamins for Kids, because a happy child is a healthy child.
Renzos! You define better odd. I bet you one play chorus cost. Over 1.5, I bet you one bet. Say, both seem no go score at all. Oh, yeah, we get better payout. No worry, we there for you. Our odd, chabrat out. You know the finish. Oh, lo, we there for you. Oh, we there for you. You see, for bet, Baba. You feel we money, bet, Baba. Cash out today, easy, your bet, Baba. We get online games for you. To play, oh, God, all I want. Yeah. We get better bonus. Money, me no dollar. Yeah. Now bet, Baba, they are so. Cash out, no sharp. No, darling, no. Welcome to Bet Baba.
Register now on betsbaba.ng. Not for people under 18.
Nigerian Idol is back!
That's the stage don't set on a go scream tire. When you hear all the sabi contestants, the new judges, Omawumi, Nice, and Rick Hazani don't prepare. But now you will they wait for. Run, go arrange your Go TV. Ready your vote and your voice. So hail our superstars, may they shine.
Yes, so watch Nigerian Idol Season 9 from the 21st of April by 7 p.m. on Africa Magic. Go TV. Love it.
Mommy, my teacher said 90% of my brain will develop by the time I am 5.
Really? What else did she say?
She said I need iron in my food for my brain to grow well.
Oh, very true. And that's why I give you Cerelac Junior every day, which provides half of your daily iron needs.
And Cerelac Junior tastes so good.
Cerelac Junior with Iron Plus. It's all good, Mom.
99.3 Nigeria Info, your number one station for talk. Let's talk.
Credible journalism, bridging the gap between people and those in authority. With Hard Facts, you are sure to get only the facts.
Tune in to Hard Facts with Maryann Okon on 99.3 Nigeria Info.
All right, we're back. It's still the big hard facts. 99.3 Nigeria Info. We're broadcasting live from our audiovisual studios right here in Itimian Crescent, Victoria Island, Lagos. I'm Maryann Okon. Dr. Obadeyi is still here with me in the studio. We're talking about brain drain in the health sector. It's interesting how politicians are very quick to say to doctors, don't leave the country. Why are you living in the country? Who's going to take care of the people in your country? But then the people who are leaving would say, well, there are better working environments. Why is it so difficult? I know you can't answer this question, but I have to try to create conducive working environments for medical doctors, knowing that health is one of the most important things in any society. Being able to deliver health care is one of the most important things. Why is it so difficult for us to be able to deliver, to build that working environment? Secondly, someone from your sector is always made a commissioner for health or a minister for health. Someone leads that committee on health in the Senate. How come these people don't communicate this to their principals? And I'm asking you because you've held a position like that before.
Yeah, indeed. Well, the first question is why can't we create the enabling environment for people to stay here? It's not today's question. 35 years ago, the migration was not even there. That was not a topic on the table because anyone who left went on like a secondment. You went for 2 years, you did your training. As soon as you finish your training, you're on your way back home because when you come back home, whatever program it is you've learned there, you're able to replicate the same thing at home to a reasonable extent. Educating your children here was not a problem. In fact, most of them didn't take their families with them. They went solo and they would come back. Those things have changed. Remuneration was okay then. You come back as a doctor. If your office doesn't give you a car, you can take a loan and buy a car, and then you pay it off. All of what I'm describing to you, the living quarters, the remuneration, the social conditions for their family, all of that has evaporated over the years. Very slowly but surely, it's all gone. So I would rather not, I wouldn't call it a brain drain. That has a negative connotation. I would think about health workforce mobility, and that we should be looking at making it a two-way thing. That is, people can, by two-way, I mean you can jackpot if you think that's what you need now. We must encourage people to jackpot that. That is, when they're gone, you've seen what's there to see. You've worked there for 5 years, for 7 years. Please come home once every 2 months and put in something in the healthcare sector. There's a private hospital in Lagos that does that, which I applaud them greatly for. Most of their consultants are from the NHS or from the UK or the USA. I kid you not. And I sent many of my patients who can afford it there, because you're going to be consulting with an NHS consultant who is here for about a week in a month. They actually do that, and they come here, spend a week, and go back and do 3 weeks in the NHS. Wow. So you get the same quality of care without having to pay through your nose for it. So for me, I think we need to encourage a two-way mobility for this health workers who want to go away. I can't explain why people go entirely, but I want to guess it's not all about remuneration. If what you learned, you're able to practice, so maybe you won't leave. If you have good living conditions, maybe you won't leave. If your children can have the quality of education that you had, maybe you won't leave. All those things are not, I don't think we're able to offer doctors the life they dream of, right? Now, if that life they dream of is not available in the UK or in the Netherlands or in America, maybe they would stay here and grumble and complain. But if you can get an agency there to hire you, to process your documents for you.
Yeah.
I tell my younger ones, well, I can't ask you not to go and try it. But when you're done trying it, don't forget to come back home.
Yes. And plow. Well, that's beautiful. But my next question, which you haven't answered, is what is it that you tell your principals this, because half the time it looks like they have no idea what's happening in the sector, and it only comes to them as a shock when the doctors decide that they're going to go on a strike, or the doctors are saying we're going to down tools, or they're protesting or something. I mean, this is not new. It happens in the NHS. The doctors walk out, they stage a walkout, the nurses do the same thing, for different reasons. But in Nigeria, it looks like we keep dealing with the same issues every single administration that comes and goes. But then, I said, they pick someone from amongst you to be the ministers and the commissioners. So what is it? Make it make sense. Why are they not? Is it that they're not taking your, the advice that you're giving, or what exactly is it?
I think there are two reasons. And I'm going to be very honest here with this. I think the first reason is that it's not that the government is not aware. Everyone knows that if you are desperately sick in Nigeria today, you need to go and dust your passport. It's what we do. That wasn't the way it was before. You are now thinking, is it India or Turkey, or am I going to the UK, South Africa, the US? It's what we do within our families when somebody is very sick. We're calling our relatives there to see how we can move them abroad. And that's not how it's always been. So we are aware that when you have something that is more than malaria, more than hypertension, something complicated, you're better off getting treatment perhaps somewhere else. So we're aware of how bad the situation is. Now, the fact that we pick some of our own professionals to be commissioners for health, to be the minister for health, as I said before, the economics of it is that if you have a pot, you just, as even within a family, if you have 11 children, you will have the child who is clever enough to know how to state their own case and to justify what for boarding school. And so they get what they need before the one who is waiting for their father to know, to magically know what I need before that person gets there. I think we must learn again how the art of advocacy, of convincing our policymakers and at every level of governance, from the local government that should be taking care of primary health care, because it's right at the first step. If we're able to convince this local government chairman, there are people that we all know, they grew up with us. Look, this is about health, it's for your people. If you do this, you don't have to pay for their treatment for them. The primary health centers will take care of them. So the advocacy should be ongoing at every level of governance. I think part of it is that when we're electing these officials, health is not even part of the debate. It's not one of the things we talk about. So we can't even hold them accountable and when they get in there, because it wasn't one of the things they promised us they were going to do. Roads may be, schools may be, but health is not yet within that dialogue. So we should have development agencies or NGOs in your field, in communications, who are trained to come in when we're about to have elections, the year of the elections, and make health a debate issue. Get politicians to commit to saying, well, I will build 5 new primary health centers, or I'm not even building new ones, but I'm going to invest in renovating the existing ones. This is my plan for health workforce in terms of recruitment, in terms of training. All those discussions, I think we need to begin to have in the public space, and we're not doing it yet. So we can't hold a minister and say it's one minister who is going to do everything. At every, governance is hierarchical and stratified at every level of governance, whether it's your ward councillor, whether it's your local government chairman, whether it's your state governor, at every level, senator, House of Reps, we should be making an issue. If you look at COVID, for example, I've asked myself several times, if we transpose that template we use for COVID on the health sector proper and say, okay, as a country, for the next 3 years, which is what we did with COVID 2020 to 2022, health is going to be our focus, or in every way possible. We're just going to put everything at health. We'll get somewhere. But I don't think that's going to happen.
Well, the caveat there now makes me sad because you're saying you don't think that's going to happen. Well, Lagos, join the conversation. The phone lines are open. 0700 993 993 993. That's 0700 993 993 993. Or you can call 0201 465 7190. My guest, Dr. Obadeyi, is on standby to take your questions and your comments. Yes, we've got time on the clock to take all of that. You can join the conversation if you're watching us live on YouTube. We're on YouTube, Nigeria Info FM, on Facebook.com/Nigeria Info FM. We're also live. You can post your comments there. Or better so, you can join the conversation on X. Use the hashtag HardFact or send me a WhatsApp message. Or if you're listening from outside of the country via mobile app or on our website, join the conversation via Skype with our Nigeria Info FM. Hello, welcome to Hard Facts.
Good evening. I greet you and I greet your guest, Doctor. What is the government doing for the welfare of our Nigerian doctors and the facility of where they are? What is the government, the welfare of the doctor?
But she's a doctor. She's not the government too. So when you say what's the government doing?
I'm not talking my own.
Okay.
Nigerian doctors can go for all he cares. July 2019. A woman doctor 2 years ago was collecting 5,000 naira for allowance. That one is it for people? That one is it for professionals? So if they, I told them, tell me the Jama. If the man was giving 800 million to equip a hospital in Enugu for the same case that took his daughter to London, he stopped him. He phoned him.
Do you have a question or a comment quickly? Because you're just shouting and we can't hear what you're saying.
Okay. I said if the man was giving money to equip a hospital, he stopped him. Anybody talk?
Okay.
Thank you.
All right. Thank you very much, Koboko, for calling. Hello,
I
welcome.
think we have to appreciate him for the passion.
Yes.
There's passion.
Yeah. Hello, welcome. What's your name? Where are you calling from? Oh dear. Apologies. Do call us back. Hello, welcome to Hard Fact. Hello, we can't hear you. Hello.
Hello.
Yes. Yes, I can hear you now.
So, good evening to you and your guest.
Yeah.
So I feel aside remuneration, I feel insurance is also key. Why does doctors travel out? Is because should anything happen in the line of duty, who's responsible for them? So that one is also part of it. it would shock you to know that elevator where that doctor died has not been fixed.
Oh,
till
yes,
now.
I do know that.
Go and verify. So what are we saying? So when you tell them to jackpada and their health or their life is at risk, who is going to be held responsible for it? All these things should be taken into cognizance. Thanks and have a nice day.
All right. Thanks, Mr. Boli, for your message. Let's go to WhatsApp and take some of the messages that are coming in on WhatsApp. Someone says, Zeal from Isolo says, I want to say everything about Arsenal Football Club is sweet and beautiful. No wonder you ladies look beautiful and well done. Yes, that's
Thank
obviously.
you,
Indeed. Let's take another call. Hello. Welcome to Hard Facts.
Yes. Hello, Han.
Yes. Good evening.
Yes. Hello to your guest. Well, I think one of the key points she has just mentioned that I think I really love most is that, fine, we can't stop these guys to Japa, but what efforts are our government making themselves to let coming back home attractive to these guys? Because to be sincere, it's not that many of them are really finding it even all that easy over there. But you know what? Like Maslow's theories, human needs are just, are into variables.
Yes.
Some just want a proportionally ambient environment that just a little. They don't need too much. They just want their effort to be appreciated. They just want a very conducive environment. So what are these are governments doing? And you could see, it's just so sad. You could see, even if we blame federal government so much in all of it, what are our state governments? We have primary health care, we have secondary health care, we have tertiary health care. What are these guys doing? Somebody is being embattled now on almost over 82 billion, and some people are still saying it's political. Who has bewitched us here? How can the health sector, how can the primary health center be fixed? How many billion do they want to spend on just a primary health center that, what's it called, multidimensionally poor people can easily just walk down there and get basic health facilities. And these are the hospitals you want. The madam, of course, I'm a graduate of university, and I know what I went through, even just on the biological science that related courses that I study. You are not talking about, somebody that spent 7 years. That is if God help you. 9 years.
Yeah.
No, that is it. I know what, because I'm a product of biological science, so I know what she's talking about.
I understand.
So what's the incentive? What's the hope? And somebody is there taking this kind of money, and some people are still saying it's politically motivated. Who has bewitched us?
Thank you very much for calling. I like that you're speaking from a place of experience and knowledge. Would you mind to chip in, Doctor?
Can I speak to that?
Yes, please.
Yeah, I think the point that the gentleman has made is very apt. Speaking about primary health care, and I have good news in that area, because that was my constituency for the past 3 years until January of 2024. Primary healthcare is experiencing a revitalization in Nigeria. There's a lot of attention at that level, both at the state level and the federal level. At the state level, there's investment coming in from the different state governments, but that's not even small compared to what's coming from federal. We've had the Healthcare Provision Fund, which is it's devoting 1% of our consolidated revenue to primary healthcare, and those funds go directly to the health facilities that are registered under the Basic Healthcare Provision Fund. They have complete control. It's not about the governor or the commissioner. They have control on what they do with these quarterly funds that come directly from the federal government to them. They can hire staff, they can paint their facilities, they can change the bulbs, they can invest in cleaners. It's very much needed money that is helping us keep some of our PHCs alive. I know that there's more effort under the new plan to move more funds to primary health care. Okay. So things will change, but the rot is a almost 50-year-old rot. It will take
almost forever to deal with it. Dr. Obadeyi, I really wish that I could have you stay in the studio and answer more questions, but unfortunately, our time is fast spent. But I want to say thank you to you for being in the studio. This has been a very riveting conversation, and I'm hoping that one day we'll have you back in the studio. Hopefully, you come in person. And maybe you check our pulses for us when you're here. I want to say thank you. Thank you so much, Doctor, for coming to the studio. Dr. Bolaji Obadeyi, who is has been talking to us. She's a health economist and a public health practitioner with 37 years experience. Thank you. Always a pleasure to have great minds in the studio talking to us.
Thank you very much, Anne. It's been a lovely discussion.
Thank you. Thank you very much. Well, Lagos, we'll take a quick break. When we come back, I'll be saying my goodbyes on the show. So stay with us. We'll be right back.
Madam, you don't try this new Lush Hair 4-in-1 no lie relaxer kit. We get free neutralizing shampoo and conditioner join.
What? Me, I know deal.
You not even sabi wetin dey happen for town. You see this Lush Hair relaxer so?
E no dey pepper, e no dey burn. E go even make your hair shine like oil.
Na so, Lush Hair relaxer kit na correct. We no go make your hair cut. We no go make your hair dry. E no dey pepper and e dey relax hair well. Come buy your own.
Lush Hair. Be beautiful.
Are you 99.3 Nigeria Info? We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens.